Nepal, known best for Mount Everest and as the birthplace of Buddha, is a small country nestled between two giants, India and China. It is a land of diversity, geographically, culturally, ethnically, socially, and religiously. Nowhere else in the world does a country so small boast such an array of beauty or mystique. Nepal, a land of diversity and harmony, yes, but also a land of inequality and differences. The village of Balde is nestled in the district of Kavre. Balde is just one of the many typical villages throughout rural Nepal, where tight-knit communities make up the majority of the population. Roshni Dang is just 10 years old. After being taken to a traditional healer and a government health post, Roshni was taken to Dhulikhel Hospital's outreach centre in Balde. Here, she received initial primary care from the outreach paramedics before being referred to Dhulikhel Hospital. This is her story. Before Dhulikhel Hospital's services, patients such as Roshni would not normally have access to basic healthcare, much less tertiary-level hospital care. Government health posts and hospitals throughout Nepal are understaffed, underserviced and undermanaged. Most government health posts only open between 10 AM and 2 PM and are closed over all national Nepali holidays. Medicine is supposed to be administered free of charge to all those who need it. However, most only carry stocks of 3 months' supply, intended to last for 1 year. Even within the Kathmandu Valley, big hospitals have limited facilities and poor management. For most patients, private healthcare is not an option. Prices are often too high, even for those from middle-income backgrounds, and treatment is strictly on a pay-first, treat-later basis. After a 5-hour bus journey, Roshni arrives in Dhulikhel. Dhulikhel Hospital was founded 15 years ago. Its beginnings are more than humble. Dr. Ram Shrestha returned to his motherland in 1994 to start a 2-room doctor's practice on land near the outskirts of Dhulikhel. Faced with few supporters and many naysayers, Ram's dream of building a hospital for the poor did seem grand. Today, it remains a pioneer hospital like no other in Nepal. The hospital cherishes its principles of social equality and was one of the first hospitals in the country practicing as a non-governmental, not-for-profit organisation established with the mission of providing quality health service to the poor. "15 years later, there stands a 370-bedded independent hospital staffed by over 600 people.
I want to be there where most of the people could feel my need and also feel my presence. And both are coincidentally happening here. That's the reason how we could start. So from the very beginning, starting, I was together with them, people who could need it, and the people who could need it, and they were together with me. That's the reason why I started here.
A team of dedicated health professionals ensure that the hospital provides quality health service to people from all walks of life. No matter who comes, whether rich or poor, everyone gets the same service. Medical healthcare at its best. Strong management, dedicated teamwork, cooperation from the community, and national and international well-wishers have ensured that Dhulikhel Hospital has not only survived for the past 15 years, but that it is also expanding, making it one of the fastest growing medical institutions in the country. The hospital's policy is that no patient should be sent home without treatment, even if he or she cannot afford it. This policy derives from the strong belief that the needy should never be deprived of a human right, regardless of the cost. As a result, the hospital has faced many challenges and will continue to face many more as it strives to uphold its principles and policies aimed at helping those who have been constrained by economical factors beyond their control. Over the past 15 years, Dhulikhel Hospital has seen major developments and impressive changes to its infrastructure, size and management. It has truly established itself as an outstanding, fully fledged tertiary level hospital. Today, the hospital stands firmly on the foundations of its dream, the very same dream conjured by Ram all those years ago, that no matter what, the hospital will never deny, no matter the circumstances, that the poor are right to the best healthcare possible. The reason behind Dhulikhel Hospital's success lies in its core values. Every year, it channels over €100,000 into charity cases for treatment, medicine and referrals. In 2010, the hospital saw around 300,000 outpatients, a number which does not include follow-up checkups or internal referrals. The hospital confronts the norms in the standards of healthcare of Nepal every day by pushing boundaries, questioning principles, and proving that even with limited resources, it can and will continue to provide excellent quality healthcare wherever possible. With the help of expert staff, the hospital will strive to achieve the highest standards of healthcare for the poorest people in the community for as long as it can find support. Dhulikhel Hospital is a unique institution thanks to its original formula. It is a community-based and community-orientated hospital with international appeal and impact.
बजारमा हस्पिटल छ हाम्रो माथि गाउँमा घर छ अनि त्यही भएर उहाँ लानु भएर भन्नुभयो हिजो बेलुका त्यो तल लग्यो अनि अहिले बिहान नै यहाँ 7 बजे यहाँ ल्याइपुर्याएको छ अनि के हुनाले अनि हामीले राम्रो छ यहाँ अब आमाको ज्यान बच्यो
गोचाउनु नि भएन जोस पाउनु पर्यो यहाँका डाक्टरले मैले सुख पाउनु पर्यो मलाई यहाँ आएपछि शीतल भयो.
Dhulikhel Hospital soon recognised that a vast number of patients were still suffering from the lack of basic medical care available in rural areas, and so decided to take matters into its own hands. In 1997, Dhulikhel Hospital opened its first outreach health centre in Balwa. Today, it runs and coordinates several outreaches and works in partnership with hospitals in various locations throughout Nepal. Although it has grown significantly in size since its inception, Dhulikhel Hospital has managed to stay true to its roots and continue to serve the community first and foremost. One of the ways in which it does so is through working not just with the community, but also in the community. Every week, it runs several different health programs and health camps. Dhulikhel Hospital works with women in the community, encouraging them to participate in health programs, microfinance groups and skills training. It also works in partnership with schools and other organisations to run plantation programs, first aid training and events such as polio awareness. While the health service system in Nepal struggles through various degrees of bureaucracy and a maze of challenges, The hospital attempts to address health issues in remote areas using a holistic approach, quality service delivery, rational community-based methods, innovative public health interventions, and effective partnership programs. The hospital implements these measures and services in order to ensure that its main objective, to provide the best healthcare to the people from all backgrounds, is successfully carried out.
Definitely, this hospital is a little different than any hospital existing here in our nation. The reason behind it is this is a center for the poor of the poorest people. But it is not a place to practice the poor medicine. That makes big difference. We are very proud of the quality service we deliver, no matter how financially people are seated. That's the difference.
Roshni's journey to recovery ends where many others begin. In the developed world, we take expert medical advice for granted and consider it a human right. It's easy to forget that millions of people throughout Nepal do not have this luxury. Due to constraints in the national healthcare system, Nepal has only one doctor for every 10,000 patients, but it is estimated that in the more remote places, the situation remains worse, with as many as 100,000 patients per doctor. 8 in every 10 childbirths occur unattended by medical professionals. The result is a death of a pregnant woman every 4 hours. The statistics speak for themselves. 85% of the population live in the rural areas. Nepal is fast becoming a country of disparity. The gap between the urban rich and the rural poor grows wider day by day, leaving the rural population hugely disadvantaged. Those living beyond the reach of basic sanitation account for 47% of the population in Nepal, and every year 10,500 children under the age of 5 die from diarrhea-related diseases. It is estimated that Nepal loses over €100 million annually due to illnesses caused by lack of access to these services. That's 4% of the gross domestic product. Nepal does not need to add to such statistics, nor does it have to. With the help of many of our current well-wishers, fundraisers and donors, Dhulikhel Hospital has already reached out to several communities where previously no one else had. While Dhulikhel Hospital works hard to sustain its reputation as a model institution and example fit for replicating in other developing countries like Nepal, the challenges which it faces now and in the future are slowly catching up. The hospital remains the pride of not only the local community but of the nation. Current programs run by the hospital require constant upgrading, funding and external support, which without international well-wishers the hospital would not have been able to sustain. These are the people who give to the hospital in alternative ways and recognise that every small step they take to push the hospital forward results in a giant leap for the communities of Nepal. Visit Dhulikhel Hospital today and one will see not only the evidence of its past well-wishers, but also how much more there is left to do in this small town for the benefit of an entire nation.
Concerning my wish and worries, main part is the sustainability of this endeavor, what we have achieved till today. But there are many means to support this hospital in terms of sustainability. That is, for example, in Nepal we have everywhere water resources are there, and producing a small hydropower, selling the power to the national grid, the rest money we can use for the charity fund we need it here, and also part of it could be spent for the sustainability of this institute.